Hello, good evening. My name is Leigh Jorgensen. I'm with Williamson Health. I'm the oncology program leader. Thank you for joining us tonight on our breast cancer discussion. We're very happy to have Dr. Slater here with us, one of our breast surgeons, and we're gonna have a lot of interesting conversation tonight. Dr. Slater, tell us about you.
Thank you, Leigh. Hi, my name is Jared Slater. I'm a board-certified general surgeon here at Williamson Health. I'm not a local to Tennessee. I'm actually from Minnesota. You might hear it in my accent compared to Leigh. But I trained up in Minnesota at Mayo Clinic. I worked up there prior to going to University of Florida. And then we made our way here to Franklin, Tennessee. So we're very excited to be here, be part of an amazing team that I've seen take some amazing care of our breast patients. So we thought this would be a great way for us to talk to our Facebook followers and the community in general about breast health, who we are, what we have to offer, and maybe just answer some basic questions that our Facebook audience might have about their breast health. One thing we wanted to say before we get started was breast cancer and breast disease in general is very personal to each patient. And what we're saying here today might not be specific to each patient, but it's a good overview of things you can look for, maybe risk factors that you can help mitigate with lifestyle changes. But the key thing for each patient to take away is that if you have a concern, meet with your primary doctor or one of us on the breast health team to discuss an appropriate workup.
Right. And are you saying that I have a Southern accent?
No, I have the accent.
Okay, just wanted to clarify that.
Lee's speaking the right way. I need to adjust my drawl a little bit.
All right. Just wanted to clear that up.
No, I hear it and I appreciate the accent. So first we thought we'd kind of mention really what breast cancer is. And it might sound silly, but breast cancer is cancer of the breast, either male or female. It's more common in females, obviously. That's what we typically hear about. But men can get breast cancer, and so it's important for both genders to be aware of that. The breast is typically is actually made up of two types of breast tissue, ducts and lobules. And those are the two types of breast cancer that we typically see. So that's what patients will typically hear us talking about as a ductal cancer or a lobular cancer. Okay. It is one of the leading causes of cancer and cancer death within women in America. So it definitely is an important topic for us to go through. So I have some notes that I've taken too, so I might follow along here for us. But there are a lot of risk factors that women have for developing a breast cancer. A lot of them, unfortunately, they can't change. So I thought I'd talk about a few of them just so people are aware, things that they might have to watch for if they fit these categories. One is increasing age. So we're all blessed to grow old, but with that comes some risk. And we typically see that with each decade of life, we slightly increase our risk of a breast cancer. Women typically have a lifetime risk of around 13%, but with each decade that increases, it almost doubles after the age of 70. So that's something to be aware of wherever you fit in that age category, to really pay attention to your breasts and make sure you're getting routine exams and talking with your primary doctor. Female gender is actually another risk factor, being female with breast tissue that puts you at a higher risk compared to a man. And being Caucasian. We see breast cancer across all races, but we know that white women typically have higher risk of breast cancer. Those are things you can't change. Also being tall, having dense breast tissue, and having increased bone mineral density are risk factors that you can't change, but are good things to know for following up with your doctor. Factors that you can change are things like obesity. We know that women after menopause have a higher risk if they're obese. So working to decrease their weight actually helps mitigate that risk. Other things that we look at with risk factors for women can be use of hormone replacement therapy. I know we've talked about that.
Yeah.
What's your experience with
a lot of questions that I hear from patients are, how long is too long to be on hormone replacement therapy, or is there a correlation of the length of time?
Yeah, and those are great questions. I think if you have a family history of breast cancer, or specifically a genetic mutation, you need to be careful and have that discussion with your gynecologist, because there are some studies that show there could be a risk with that replacement therapy.
And do you consider hormone replacement therapy the same as birth control or oral contraceptives, or is that a different category?
It is a different category. We know that the use of oral contraceptives can slightly increase the risk of breast cancer in a woman while she's using them, but that risk goes down or goes away when she's stopped. So typically we see that a little bit during child birthing years and slightly elevated after birth of a child. Some other things that we look at too are use of testosterone or androgens, and insulin resistance has been shown to slightly increase your risk for breast cancer. Other things that you can't really control but are good to know, and we'll ask patients this when we see them, is how old were you when you had your first menstrual cycle, or menarche as we call it in medicine, and how old were you when you stopped having menstrual cycles? Because we want to see how long you were exposed to hormones during your lifetime. We also look at how many pregnancies have you had, how old you were at the first term pregnancy. You know that later age or being more advanced in age with your first pregnancy is slightly less protective than an earlier pregnancy.
Also, have you seen any correlation with breastfeeding?
There's a decreased risk of cancer with breastfeeding, and there are studies that support that.
Okay.
Is that your experience?
That is.
Other things that we look at are family history and genetics. That's a big question that we always get. What's my risk? You know, having a family history. So we have excellent genetic counselors in our facility here who can really go through that with the patient. You know, can you tell us about her, or the genetics?
Oh, so we have Navigate Genetics. Stacy Holloway is one of our places that we send and refer patients to for genetic counseling and genetic testing. Also, in addition to that, most of our patients, if they're diagnosed with breast cancer, will be referred to medical oncology and have genetic testing there. It's been my experience that from an accreditation standpoint, you know, at least every woman should have that conversation.
Yep.
And be presented with that conversation of genetic testing.
Absolutely.
Regardless of, you know, very high risk factors or not.
And it's a question we get with every patient who comes through our door is, you know, what should I do now, especially if you have a diagnosis of a breast cancer? But those are things that we're happy to help you navigate when you come to see us. I wouldn't worry about it unless you need to, or if you have that strong family history, that's something we can work with you on. Two more things I thought were important to talk about for mitigating or decreasing your risk of breast cancer are smoking and alcohol. So I know holidays are coming. It can be a little stressful. You might be tempted to have more than 4 drinks a night.
Is it 4 drinks a day that's supposed to be the cutoff?
I think that might be the cutoff
Okay.
around that. So we'd say try to limit that a little bit so that you help decrease that risk. I think it's more over time, not just the holidays. We might have to give people a little grace
I
with
do that year after year after year, and
It adds up.
yeah.
Yep. So just be mindful of that. A couple of things that really can help decrease your risk of breast cancer. Again, breastfeeding we talked about, but being physically active. Physical activity and a low-fat, high-carb diet actually helps decrease breast density, which is a risk factor for breast cancer. So those are things that women can do to help bring that risk down. I also think it's important to really know your family history. Because if you know which side of the family has been affected by a cancer or different types of cancer, whether it's ovarian, breast, colon, or pancreatic, it could predispose you to certain genetic mutations that would be helpful for us to know and maybe get you screened earlier.
And not necessarily just the BRCA mutations. There are other genetic mutations that we test for now that we analyze and they're predicted to cause increase in cancer risk with some of those.
So when we know that about a patient or know that there could be a family history, meeting with our genetic counselor, navigator, and whatnot, they can help work that patient up and guide them as to which testing they need and help us really fine-tune surveillance or what they need for surgery. So it's important to have all components of breast health known to us to really take good care of our patient.
That's right.
One of the other questions I typically get is, when do we start screening? I know most women know that number 40, once they hit 40, they should start screening. It's hard to do. It's hard to get in that habit, but I've seen it save lives.
I have to.
So
Sure.
I really encourage women, whether you have a family history of breast cancer or not, I think it's critical to at least get a baseline mammogram at 40 so we know if there's any concerns. Really, before that, breast tissue is too dense for us to really get an adequate read of risk. And most women before that, without a family history or high risk factors, don't need a mammogram. It'd be more on an individual basis. Any other thoughts on mammograms?
How would one know that they have dense breasts?
That's a good question.
I mean, in general, and you may have a different opinion, but usually at that baseline mammogram, they're going to find out, and
Yep.
I know that if the radiologist considers you to have dense breasts, you're going to be notified of that. That's actually another component of making sure women understand that, because it does increase your risk of breast cancer. So you're notified with your results if your breasts are dense or not.
And it's important to know that history,
Yeah.
so that your primary doctor can make sure that you're getting those routine mammograms and to follow a dense breast. The other thing that I hear patients ask me too is the 3D tomography,
Yeah.
or tomosynthesis for breast, and that does really help see the breast as a 3D object rather than just that one-dimensional mammogram. That's something that we offer here to women.
It is.
So that's a new technology that's really benefiting women, because we're able to detect breast cancers that are much smaller and get much earlier detection, which is amazing.
It really is amazing. Of all the screenings out there, I mean, it's such a lifesaver to catch.
It is.
It is very, very small.
And I've been so impressed with our radiology colleagues. They look at these mammograms and they can find the most minute area that's suspicious to them, and we work it up and we can find it's something that's an early stage cancer and save someone's life. So that's pretty incredible to have colleagues that
Yes.
are that gifted to really help our patients. Any other thoughts you have about breast health that we could talk about before we go to any questions?
I think the other thing just to keep in mind, we're talking a lot about breast cancer, but there are other breast diseases
Yep.
that also require closer monitoring and follow-up. Sometimes you may have a biopsy and it's truly benign and there's no follow-up needed, but there are other diagnoses that might need to talk to a surgeon.
Yeah.
And maybe that needs to be removed. So,
And I have those discussions every day.
yeah.
There is a lot of benign breast disease that on a biopsy or a mammogram it looks suspicious, and then a biopsy will show us there may have a slight increased risk of something more worrisome, so it'll warrant an excisional biopsy, which is a small procedure that can give someone a lot of peace of mind that there's not an underlying malignancy, or alert us to something that's a higher risk factor that will change how we survey the patient down the road. So those are really helpful to know.
Yeah.
Another thing that we've talked about too is self-breast exams. I tell women, we don't expect you to be a perfect diagnostician with your breast, but we think it's helpful to know your breast.
Right.
And every month, if you do it at the same time, like 2 weeks after your cycle, if you just do a thorough breast exam, you may never feel anything, but you get to know your breast. And then if there was ever to be a change, you would notice it right away. And that's the kind of thing that is also saving lives for that early detection. So,
and I think the other thing that we were talking recently is just to understand that if you are diagnosed with breast cancer, that every person's story is individual. We often encourage patients here not to utilize Google in extreme because everybody's story is different.
yeah, I think it's so easy to look on the internet for guidance, and some of these sensationalized blogs really go to the top, and it can scare people. And really, they have a very simple treatment plan that they do very well with. So it's hard to compare your story to somebody else's story when you really get that individualized care with your doctor.
Right.
I always tell my patients, when you come and meet with me, we become a team, and Leigh included. We talk about these patients to make sure they're getting the best care. We want to listen to what the patient has to say and what their personal experience is, and then how we can enter into that conversation to give them the best outlook and quality of life. So it's important to know that if that is something that you are experiencing, we're here for you to help individualize a plan that's best for the patient's needs. And that's our number one concern.
Absolutely. So you want to take some questions?
Let's do it.
All right.
Why don't you take the
Let's
first?
see. Okay. You guys be sure to send us in some questions if you have any. Okay, we have first question. If men are at risk, what age should they get screened?
So we don't typically screen men for breast cancer. I suppose if a family history is very strong, or we know of a mutation like a BRCA, then men are at an increased risk. So if you know that family history, it's good to do an exam, a self-exam. That's not the best diagnosis, but then you could go to a screening mammogram if you felt an abnormality. But then again, it's best to talk with your primary care doctor about your individualized plan and what the best surveillance would be.
Okay.
All right.
So our next question is, what is Williamson Health's Breast Health Center?
So this is a great question for you because you know this very well.
So Williamson Health Breast Center actually encompasses a lot of areas. So it starts many times in imaging and goes all the way through treatment. We have a physical location, and we have actually 3 surgeons in the actual breast center. We have an additional surgeon that also does breast surgery here. But another point that I like to point out is we have wonderful breast navigators, and we really utilize navigators to help patients overcome barriers to care. Oftentimes they are the first that interact with the patient when they receive their diagnosis and help patients get to those next steps and understand what's going on, because it's very overwhelming when you're diagnosed.
It's scary to hear that word cancer.
It is very scary.
Or even scary just to hear that you have a mammogram that's abnormal. And oftentimes we'll have an abnormal mammogram with benign disease, but just that wait time is terrifying.
Yes.
And so we like to get patients in as soon as we can to have that discussion, answer the questions, and kind of decrease some of those fears while we're waiting for that diagnosis.
Many times there's more, diagnostics that need to be done, but we can kind of help facilitate that in a timely fashion.
Yeah, I'm impressed with the team at the breast center because everyone has fine-tuned their role, and it's nice to see a seamless effort to take care, or a seamless process to take care of the patient. Dr. Rebecca Baskin heads up the breast center.
Yes.
She's an amazing colleague that's done amazing work with the breast health here in Williamson County. She's really formed a great team that's approached breast care for our county and our patients.
Yes. She's actually the director of our breast program, and then also our interventional radiologist too. And I mean, as I said, it encompasses a lot of people and a lot of services that make up our breast center.
I also am impressed with our breast conferences because in the mornings we meet as a multidisciplinary group where we have medical oncology, radiation oncology, the breast surgeons, medical doctors, pathologists, radiology.
Yes.
All of us meet together to discuss our breast patients, the diagnoses that we see, the imaging that we found, and how we can best care for each patient. So if I was a patient, I would love to know that I have all these people in one room discussing how we can best treat my disease.
That's right, and you get everybody's input and opinion, and it's a really good thing to have that. It's important.
And it brings up issues that I think everyone needs to hear for how we best manage these patients so that we can get them back to normal life without skipping a beat.
Okay, next question. I guess we got off on a tangent.
We did. So I have a family history of breast cancer. Am I at an increased risk to get breast cancer? And should I consider getting genetic testing? A lot of the familial breast cancers, they may have a genetic component. I think if the family member who has a breast cancer has genetic testing, it's helpful because then you know if you might be at a risk or could be a carrier for it. Those are great questions, though, for the patient to present when they come to us, so we can look back at their family history. And if there's a strong predisposition for it, I think genetic testing is warranted. Yeah. Any factors that you see or that would guide you to tell a patient to seek genetic counseling?
You know, I think age at diagnosis. You know, if we had someone under 50 in general,
which is very young.
Yeah, it's very young.
Yes. The older I get, the younger that is.
And then the family history, yes. I mean, I agree with what you said. Okay, so next question. Can wearing my bra too much cause breast cancer? Is there a particular kind of bra that is harmful or helpful? That's a really good question.
So I have not seen any studies that would say that wearing a bra or a certain type of bra would predispose them to breast cancer.
I haven't seen any data either. Now, I've heard people throughout life say you shouldn't wear underwire bras, but I haven't seen any data that supported that.
Yeah, I would say there's no conclusive data that would make me say change your bra or not wear one.
Right.
I think
that's what we should do, just not wear one.
That's up to you. It's your choice.
Okay, does insurance cover mammograms?
So insurance, I'm not an expert with insurance.
I'm not either.
But I do believe they cover screening mammograms, but you're responsible for your copay, or I think copays for mammograms or for diagnostic testing.
So, and again, I'm not 100% on all this, and the thing is it changes, but sometimes that's covered in your insurance plan, and you actually don't have a cost out of pocket for that. There also are some programs out there that offer mammography with no cost, such as the Tennessee Breast and Cervical Program. But in general, the answer to that question would be yes, it would be covered.
And I've been impressed with how insurance usually does support breast health.
Yes.
Whether it's surgery, reconstruction, the workup for things. And that's something that we work with the patients on to make sure that we can get things covered, even if it involves us appealing the case.
Right, or peer-to-peer.
Yes, so, I know Dr. Baskin and Dr. Brown as well will fight tooth and nail for our patients to make sure they get the care that they need.
Yes.
So don't let that part worry you as a patient.
No. Okay, let's see. Are 3D mammograms the new normal? What makes them different?
So the 3D mammogram is called tomosynthesis, and it's a mammogram, but it takes multiple images rotating around the breast, and put together it creates like a 3D image. So when I look at those mammograms, it's almost like a CT scan of the breast. We can really see through the entire portion of the breast. It does allow us to detect cancers or lesions much smaller and for earlier detection. So I would say that they are becoming the new normal.
Yes.
We're fortunate that we have that technology here, and that we have an administration that supports us having that kind of equipment. And that is what I like to see with my patients if we can, because I do think it helps promote earlier detection.
Yes. Okay, let's see.
We're looking at more questions here.
Can birth control or other forms of hormone use increase my risk of getting breast cancer?
So it can. So we know that the use of oral contraceptives, during the use of them, there's a slight increased risk for breast cancer. But once you stop, or that risk is temporary, once you stop the use, that goes away. Hormone replacement therapy, especially if you're predisposed or have a family history, there is correlation with developing a breast cancer, especially I see that with the hormone-positive cancers. So that's a great discussion to have with your gynecologist, because they can talk you through or discuss with you the studies and what those risks are. But if there's a question, we in surgery are also happy to talk to you about what's best for each patient.
Those are good questions.
They are good questions. All right, we have
Last
one more.
question.
Oh, that's a really good one.
What is the best way to support a loved one going through breast cancer?
You know, I'm really impressed with the families that I've met here that present with my patients who have breast cancer. because their whole focus is getting their loved one through it. I think it's best to have that discussion with your loved one.
I do too.
Ask them, what do you need from me?
Yes.
What can I do to be supportive? And there are going to be good days and bad days. You might have to ask each day, what do you need today? But what's your experience?
Well, I will typically tell the person that's diagnosed with cancer to maybe be very specific in what help that they need, because oftentimes their loved ones really do want to help, but they don't always know how to help. And so I tell the patient, be very specific. I need you to do this load of laundry that's been sitting in my laundry room for the past week, or pick up my children from school on Tuesday. It's specifics that they need. I generally think that is helpful.
Yeah. I think people don't know how to help.
Right.
And if you can be specific, people want to offer that.
Yeah.
I know my wife has said in the past, I don't know what to do. I don't know how to help them. And if they say to her, if you could just bring a meal, she's like, I can do that. So if you have a specific request, people love to help. And I think it gives them a purpose to really contribute to you getting better.
Yeah.
So be specific. And same with us, part of your medical team, be specific with us what you need so that we can offer that to you as you're going through treatment.
Yeah, and as opposed to just being specific, be sure to ask for help.
Yeah, that's a good
because
point.
again, people don't know what to do, and I think traditionally people who don't know how to help or haven't been through this with a loved one, they may sometimes kind of withdraw or just kind of stand back, but let them know you need help. I need your help.
Yeah.
It's hard to say no when somebody asks you that.
Yeah. And I think it is hard for people to ask.
It is.
And
it is.
Everyone wants to help you, though, when you're in this situation. So ask us, ask your family, and you'll get the support I hope that you need. We have one more, I guess.
Oh, a bonus question.
Bonus
Let's go.
question. What resources do you have to support breast cancer patients?
Well, I would say, that's another broad question.
It is.
So again, I'm going to always talk about our breast navigators as resources, but we need to talk about our equipment, our surgeons, our operating room capabilities. Help me out here, Dr. Slater. There's so much.
We really have the full spectrum.
We do. We do offer the full spectrum.
I would say Williamson Health offers really a multidisciplinary approach to caring for our cancer patients. With every specialty, even our breast conferences that we have, to be able to all come together in one meeting and talk face to face with each other about each specific patient.
Yeah.
That alone is amazing.
It is.
But then when I consider the equipment that we have, our OR capabilities, my OR teams are amazing. And they 100% are dedicated during each case to caring for that patient. And I see it across the board. So I think if you have an issue or a need with breast care, I recommend come to see us, and we can really walk you through the process that's best for you, and we're there to guide you through it.
And even though we're talking about breast cancer tonight, we're here for you for all other types of cancer as well.
Yeah.
We provide other cancer screenings and services, and I feel like we do a good job with that as well.
Yeah, it's a great team here, so I'm proud to be a part of it.
Yes, it was fun.
It was fun. I appreciate you for joining me. So thanks to everyone who joined us tonight. We appreciate your time. And as always, if you have questions, don't hesitate to reach out to us. We're always available and always happy to help.
Thank you.
Thank you.